Chapter 8 Antiadernergic drug. Sympatholytic Antiadernergic drug. Sympatholytics. Antiadernergic drug. Sympatholytics. These are the drugs which antagonize the pharmacological action of sympathomimetic agent or disturb the function of sympathetic nervous system inside the body. Classification. Antiadrenergic drug can be classified under two heads: direct acting adrenergic receptor blockers or adrenergic antagonists. These drugs interact with adrenergic receptors and by occupying this site do not allow an adrenergic agonist access to the receptor. Indirect acting adrenergic neuron blockers. These drugs do not block receptors, instead, they act presynaptically at the nerve terminal to causes a decreased release of the endogenous neurotransmitter norepinephrine. The adrenergic neuron blockers interfere with the transmitter function of adrenergic neurons by the following mechanism: by interfering with the synthesis of catecholamines, example methyl dopa and methyltyrosine; by interfering with storage of norepinephrine, example trazepine, it depletes any stored in adrenergic neuron; by preventing the release of norepinephrine, glutathione. Adrenergic drug. Adrenergic drug एड्रेनोरिसेप्टर ब्लॉकर्स, जिसमें अल्फा ब्लॉकर्स, नॉन सेलेक्टिव फेनोक्सीबेंजामाइन, सेलेक्टिव अल्फा ब्लॉकर्स प्राजोसिन, अल्फा 2 ब्लॉकर्स योहिम्बाइन, एंटीपामेजोल, आइडाजोजैन. बोथ अल्फा एंड बीटा ब्लॉकर्स, एग्जाम्पल लेबिटोलोल. बीटा ब्लॉकर्स नॉन सेलेक्टिव propranolol, selective beta 1 blockers metoprolol, atenolol, acebutolol, esmolol. Beta 2 blockers butoxamine. Adrenal neuron blockers, drug inhibiting any synthesis, methyl dopa, methyltyrosine, drug inhibitory any storage, trazepine, drug inhibitory any release, butyritylium guanethidum. Pharmacological action of sympatholytics. Pharmacological action of sympatholytics. CVS. Heart rate, force of cardiac contraction and cardiac output decrease. NV. The effect on a normal resting heart is not appreciable but become prominent under sympathetic overactivity, exercise motion. BP, epinephrine reversal, net result hypotension. Respiratory tract bronchoconstriction, skeletal muscle relaxation, eye reduced secretion of aqueous humor and intraocular tension, thus helpful in glaucoma. Antiadrenergic drug and their clinical usage. Antiadrenergic drug and their clinical usage. Alpha blockers. Alpha blockers like prazosin etc. are used in human therapeutics as vasodilators in emergency control of dangerous high blood pressure or in peripheral ischemic disease. The ability of a alpha blocker to reverse the effect of xylazine has now given this drug a veterinary role. Antipamazole. Alpha 2 blockers selectively antagonize metadomide alpha 2 agonist. Idazojan. Alpha 2 blockers selectively antagonize xylazine alpha 2 agonist. Yohimbine is in general use as alpha 2 agonist. Beta blocker. Pronethalol. It was the first beta blockers to be marketed. Although effective in controlling arrhythmias and hypotension, it was found a carcinogen in mice and was later withdrawn. Propranolol. It is a non-selective beta 1 plus beta 2 antagonist. The drug is a competitive antagonist of isoprenaline at beta adrenoreceptors, useful in angina pectoris and protect the heart from sympathetic drive. Inhibit the metabolic action of adrenaline like muscles and liver glycogenolysis and lipolysis, bronchoconstriction and antiarrhythmic for heart. Azibutolol, metoprolol, atenolol, cardioselective beta 1 blockers used for angina pectoris, hypertension, cardiac arrhythmias, etc. Thank you.